Let's talk about the difference between the emergency room and the urgent care center. Which should you use and how do you decide? First, we'll talk about when to go to the urgent care center. If you have an issue that needs to be addressed but is not life-threatening, you may not need to go to the emergency room. Here are some common conditions that are more suited to a trip to the urgent care center. Sprains and strains, x-rays and lab tests, fever, coughs or flu, diarrhea or dehydration, skin rashes and infections. On the other hand, if you have an injury or illness that is life or limb threatening, go to the emergency room. Some conditions that warrant this kind of treatment are chest pains, dizziness or fainting, major burns, deep cuts or bleeding that won't stop, and broken bones. Knowing the difference between these two types of injury or illness can help you determine when to go to the emergency room and when to go to the urgent care center. We all know how it feels to wait in the emergency room for hours. Estimates are that nearly 1/3 of ER visits are not emergencies. Those non-emergencies crowd emergency rooms and create longer wait times for everyone. You may have to wait 3 times as long for treatment in an emergency room than you would at an urgent care center. When in doubt, call 911 and ask for advice. The trick is to seek the appropriate care option and never risk your health.